This is BBC World News. I'm Yalda Hakim. The latest headlines. Tennis world number one Novak Djokovic has tested positive for coronavirus after attending a much criticised tennis event he organised last week. Alarm in Florida and Texas as cases of coronavirus surge. Officials there urge people to wear face masks. Now, this week on Life After Lockdown, we're discussing how global efforts to fight the coronavirus pandemic may lead to other diseases being overlooked. The World Health Organization carried out a survey last month across 160 countries. They found a huge reduction in the services and treatments that were being offered for other diseases such as diabetes, heart conditions and cancers. That's significant considering that non-communicable diseases account for 41 million deaths each year. That's the equivalent of 71% of all deaths globally. People living with some of these other diseases are already at a high risk of suffering severe symptoms of even dying from COVID-19. Well, to discuss these issues, I'm joined by Dr. Bente Mikkelsen, who wrote this report for the World Health Organization, Katie Dane, who runs an organization which works to tackle these kinds of diseases, and Professor Srinath Reddy, president of the Public Health Foundation of India, who joins us from Delhi. Thank you all for joining us. Dr. Mikkelsen, I'll begin with you. Just tell us a little bit more about this particular report.
Thank you for having me. And first of all, I want to tell you one more thing, which is also very alarming. So since the COVID-19, actually, it is the people living with non-communicable diseases, cancer, diabetes, lung and heart diseases, that are most vulnerable for also die and be severely ill from COVID. So we have seen that 50–60% of those who actually die from COVID have heart diseases, diabetes and also lung diseases. So that's important. So first of all, they are very vulnerable. So it's a kind of a deadly interplay by the very high numbers of deaths caused by non-communicable diseases and actually getting COVID. So that's number one. Number two is actually what we proved or documented by the survey that we did in mid-May. So it was like 160 countries that took time out and answered this survey. And I think it's extremely important because this informs us and all the countries that it is a high need to include NCD and the essential service for NCD into the national preparedness and response plans against COVID now under development in most countries.
So given we know this, and this report and survey now indicates how vulnerable these people are, what advice is the World Health Organization giving these countries? What exactly is the WHO doing?
So first of all, we need to continue to prevent against these diseases because, as I said, having the diseases is already a high risk when you, in addition, get COVID. So you have to reduce the risk factors. You have to reduce and stop smoking, alcohol, live a healthy lifestyle, be physically active and so on, even during confinement. So we have done a lot of guidance, campaigns, and try to also mitigate against, disinformation that has been coming out during COVID. And the second one is we are developing and have developed guidance on how countries can tackle the situation with both COVID and at the same time uphold essential services to these kind of patients.
Let's just bring in Katie, because you deal with people on the ground. You see these people every day. Just tell us how they're struggling at this point in time.
Yeah, thank you. I think we're seeing, from our perspective, four main worrying trends of how COVID is impacting on people living with NCDs around the world. The first one is very much that living with a chronic NCD has essentially become a whole lot more difficult during the pandemic. Obviously, as Bente said, people living with NCDs are more vulnerable, are at higher risk, and so have been asked to isolate, to shield and be away from their families and their health services. Secondly, as health systems and health workforce are really deployed to respond to the pandemic, we're seeing that NCD treatment and care is really being squeezed and essentially demoted in many countries. And for people living with NCDs, this isn't just about being left in the lurch. It's really about life and death. If you take, for example, people living with type 1 diabetes, whose lives are reliant on a regular supply of insulin, even before the pandemic hit, we knew that insulin was inaccessible and unaffordable for many people in developing countries. And what the pandemic has done is really just made this an awful lot worse.
And I suppose in many ways, people are being asked to stay away from hospitals because, you know, they can catch it if they go there. So just access to these resources in a regular way, or being able to go to your health official or any kind of medical expert, is not there either.
Yeah, exactly. So we're seeing an impact on health-seeking behaviour. People are staying away from health services. And so we're seeing a huge increase in undiagnosed cases, for example. And again, this was a major challenge before COVID. So, for example, 170 million people are estimated to be living with undiagnosed diabetes and over 1 billion people with uncontrolled hypertension. So this was a problem already. Because of the way that obviously the COVID pandemic is impacting upon people's availability and ability to go and actually access health services and people's worry about being infected, we're seeing undiagnosed cases really stacking up, which could have a really severe consequence in the longer term.
Let's go to Professor Reddy, because you focus mainly on India. Is this something you're seeing increasingly in the country there?
Certainly, India has a special problem because despite the fact that we have a younger population, we have a very high prevalence of risk factors like diabetes and hypertension and even chronic respiratory disease, even from 30 years onwards, so very much in the productive middle age. And therefore, despite the demographic advantage of having a younger population, which is generally supposed to be protective against COVID, we still find a huge amount of vulnerability in the midlife years. And that is a major cause for concern.
And of course,
secondly,
sorry, go ahead.
And secondly, having a system of health services which is relatively weak across different parts of the country. Some states have a strong health service, others don't. Both chronic continuous care as well as emergency care for non-communicable diseases suffers.
And of course, you had a sudden lockdown as well that really left people scrambling, people trying to get back to their villages, but also a lot of people who weren't from Delhi were being told, don't come and use our hospitals or the hospital beds. This is purely for residents.
Well, some of those have been countermanded, those orders, but certainly the fact that the lockdown was sudden really did not leave much space for people to start making preparations. And particularly even in terms of the food and agriculture systems, when supply chains break down, access to healthy foods actually becomes very tenuous. And you have to depend upon unhealthy foods with long shelf life, which are usually full of hydrogenated fats and other unhealthy products. And healthy foods like fruit and vegetables, which are easily perishable, do not actually get collected from the farm and get transported to the market. So not only the services are hindered for health, but also even some of the things that build up your innate immunity, like healthy foods, are greatly in short supply.
Let's just bring in Benti, Professor Reddy, because Benti is giving Professor Reddy is giving us a sense or a picture of what it's like there in India. But just globally, we talked about some of the numbers there. Before the pandemic, what sort of impact and pressure was this putting on health services, these types of diseases, in a normal environment?
Mm-hmm. So even in a normal environment, these diseases are really the big diseases in the healthcare system. And that's also why all the heads of state and governments have committed themselves to both prevent and manage these diseases better. So I think it's no reason to discuss anymore that we really need to work harder. We have a lot of tools developed from WHO and with countries. So there is a possibility. Actually, the investment for mitigating and managing NCD is not so high. For every $1 that you invest, you will have a return of investment of $7. So I think the pandemic has been a kind of an amplifier.
It's about catching it early is the point that you're making there.
preventing, really getting the healthy lifestyles on, quit tobacco, basically reduce alcohol, being physical activity. So that's very important. But even when you have the diseases, you can do a lot. I mean, one of the main things for us is to build a primary health care system in all countries that can integrate and be early on helping these patients. And also, of course, it really underscored the need for universal health coverage. So what we are thinking now with the Build Back Better after this pandemic is that we cannot stop. We need to really push for these things to happen even quicker. And as I said, it is possible. We have the tools. It's even not that costly. And in the end of the day, this gives a productive population, a healthier population, and it will also make a next pandemic more easy to tackle. And I think if I can add one thing, I think also this is showing us that a humanitarian response, of course, it has to focus on a virus like COVID-19, but it is really the health system that will be the sort of the determining how a pandemic like that will affect the system in general.
Katie, just tell us a little bit more about the first-hand experiences that you've had.
Thing that is very
so just today we had
sorry, I'm just going to bring in Katie. Katie, if you could just tell us about a little bit more about the first-hand experiences.
Yeah, sure. So I think one thing is obviously the real the challenges around disrupting of care. I think the other thing is obviously that people are receiving care in very different ways. If you look at dementia, for example, people really rely on in-person care and support from families, from healthcare professionals, and this has obviously been really ripped apart by COVID, and a real sense of kind of isolation and anxiety amongst people with dementia. But also I wanted to bring in the point around kind of inequalities, because I think what COVID is really showing us is something that we've known for a long time, is these really deep-rooted health inequalities in society, and that people are facing the virus from very uneven starting points. We're seeing this in the UK, we're seeing this in the US, we're seeing this in Brazil, where it's really exposing deep racial inequalities. So in terms of what we need governments to be doing going forward, as Bente was saying about Build Back Better, we also really need to be ensuring that we're addressing the kind of deep-rooted reasons for poor health and for NCDs, and to be ensuring that governments are investing in things like social protection systems that will really support vulnerable communities and address the deep underlying inequities.
But which really brings me to my next point, and I'd like to go to Professor Reddy. Is this a big moment now to bring about fundamental change to the existing system?
Yes, very much so. Firstly, in terms of health system itself, it is very clear that you can't have an efficient and equitable surge response in the health system if it has not been functioning well in the steady state prior to an emergency situation. So we need to build universal health coverage and have an efficient and equitable health system. But the social systems, which actually act on the social determinants of health, are also very critical to address in order to build health in general, but particularly protection against non-communicable diseases. And we know that many of the determinants of non-communicable diseases lie outside the traditional health sector. The third lesson we recognize is it cannot be just government-led. It has to be all of society effort. What we need is not the classical government-industry public-private partnership, but a people-partnered public health in which there is active citizen engagement.
Indeed. We'll have to, unfortunately, leave it there. Professor Srinath Reddy, Dr. Bente Mikkelsen and Katie Dane, thank you all for joining us here on this series, Life After Lockdown. And of course, you can send me your thoughts on any of the stories that we've covered here today on BBC World News. I'm at BBC Yalda Hakim. Matthew will be with you in 30 minutes' time, and I'll see you again tomorrow.